important. I think it's important to think about the various toolbox you need, the size of the toolbox you need, the various tools that would necessarily go inside of those, and look at it over the next 5 years to say, what are all the tools that I might need inside this toolbox, and make sure that you're presenting that and making that available to your end users so that the pace of technology innovation can escalate and accelerate that much more rapidly. Because if you have to go to get a tool every time, all of us do-it-yourselfers, we know how long it takes to go to Home Depot and back because you forgot a screwdriver. If it's already in the toolbox, it's that much quicker to implement something.
I think in order to be effective in leading organizations and using AI or implementing AI, having a bit of sort of statistical literacy is helpful. And there are entire wonderful healthcare disciplines where that was not beaten into their heads early in their career. So I think I'm going to see that as a core competency. As the AI is doing more and more of the heavy lifting, you need to now be able to focus on that discernment and try to, be able to reverse engineer a little bit. Why is the AI saying this? Why is it conflicting with what I'm thinking? So those would be the parting things, is the leaders of the future will have invested in getting a certain degree of data literacy, and that no healthcare field is going to be exempt from that.
I would say to successfully really embark on an AI journey and integrating this AI technology within your ecosystem, within your organization, it should start with a clear strategy. Aligning AI strategy, aligning AI objectives, what we are trying to achieve by implementing AI technologies, and how does it fit with and align with overall organization goals and mission critical priorities. I think it's very important. Second part is assess your readiness in terms of technology, in terms of your data, in terms of your workforce, and also in terms of your partnerships or ecosystem. It's very important to do a thorough analysis about, are we ready as an organization internally and externally to embark this journey? Second part, I would say, is early engagement of healthcare professionals and patient is very crucial for training, for tailoring the AI solutions and applications in the clinical workflows, addressing their concerns about data privacy, and most importantly, in terms of understanding how do we build and understand the risk of these technologies upfront, not later in the game.
And what I have told people is focus on your workers, right? I think AI for patient care is a noble cause, but I think what AI really does a great job is making workers have to do less of the stuff that they don't like. Happier workers, and we've seen that through the IHI's quadruple aim, happier healthcare providers make better healthcare providers. And if you can create workflow efficiency, you can create space for people to trust you to do novel and innovative technologies. So in my mind, though it seems very noble to focus on the patient for AI, the more important innovations that I'm prioritizing are innovations that help out our workers to have a better day, to have to not document at 10 o'clock at night, to not have to click on their computers 20 times, to be able to open up that thought space to do other things.
Big overhead kills, and as you can tell, I've learned that as a lesson in all aspects and apply that to AI. So, lessons learned here, and again, to your point, AI is still early for us, for all healthcare systems. We're still curious, we're still playful with the technology, we're excited about it, but it's got to be kept simple. The workforce, really, their primary mission is to take care of patients and not to have overcomplicated technology put in front of them. So keeping it basic, keeping it transparent, and keeping it easy to understand would probably be the greatest lessons learned at the most simplistic level with regard to AI today.
But this is going to be a process of great learning, and our tools are going to get more sophisticated, and we're going to get better at leveraging these tools over time. But my biggest advice is, again, create that buy-in, support, governance, and know that these are learnings together, and that no one person or probably even one vendor can solve all of our problems.
I'm learning a ton from talking to younger people now. I make sure it's a part of what I do every day because just the way that they can inherently grow up in this technology and understand it is different than having us as adults learn it. And so I tell everybody, please look at the younger generation. When I say younger, I mean all the way down to 5th grade. They really understand how these things work. So take advantage of the fact that you might have them around your house or in your neighborhood and start asking. I think you'll learn a lot about different ways to think about AI moving forward. But I think if we put the guardrails on now, if we have governance, if we have mechanisms to measure and iterate, we will set it up in a way that when the generations who really grew up in this know how to use it, they're going to be able to fly.